Hi, my name is Eric Wolak, and I'm in Miss Susan Kane's Communication 110 class, and I am here to give you a speech on how to take an albuterol MDI correctly. This, in front of me, is my speech outline. Some studies have shown that up to 70% of people do not know how to take their MDIs correctly. Those studies also state that there is a direct correlation between how well or what kind of technique is used with the MDI and to how well the medication is delivered to the tissue where it needs to get to. That being said, to be able to increase the efficacy of this breathing medicine, we need to take into consideration the medication characteristics, the administration techniques otherwise used for all respiratory medications, and the use of a spacer if needed. So over the next few moments, I'm going to be demonstrating the hows and whys of how to take an albuterol MDI. What an MDI is, of course, what everybody should know is that, or that I want you to know, is that an MDI is an inhaler. It's a medication delivery method. It aerosolizes the albuterol so that people can get it down into their lungs. So, first off is the medication itself. The medication that we're going to talk about today is albuterol. And what it does is it's a muscle relaxant, if you will. It's a bronchodilator. What that means is that it tries to relax the smooth muscle that lines the airways. So if it's tightened down at all, it's actually going to help to loosen up those muscles to actually open up the airway, and it's easier to breathe through a bigger pipe. So, we know this information via the package insert that comes with it, which is also filled with a lot of other information that we need to know about the albuterol. You might ask yourself, why am I talking about albuterol as a specific medication? For the purpose of this speech, I'm using the albuterol because it's one of the most prescribed medications that's out there today for breathing problems. It's a very common respiratory drug. The package insert states, how the medicine works. We've already gone over some of that. It also states that the duration of the drug itself, the onset, the peak effect, and the total duration of medication time and so forth. So the duration of the albuterol medication, its initial onset is about 5 minutes. It can start to take effect and open up the lungs. Its peak effect comes on in about an hour. Now the total duration that you take the medication is going to be, or the total duration of the medication itself, is right about 4 to 6 hours, depending upon the person and how their body breaks down the medication. The side effects that we need to know about of the medication is that the albuterol works on the sympathetic nervous system, which is like the flight or fight response. What that means is if you have to run from a bear, you actually have to get your heart rate elevated, your lungs have to be nice and opened up to get some very good breathing going on, and then circulation has to actually get that around the system. So that also means that with that comes increased heart rate, increased anxiety level, and also that the nausea and vomiting and things like that, may also occur. Now, the vomiting portion of it, we usually don't have with the albuterol. So, otherwise, those are some of the peak side effects that are, most side effects that are done. The normal dosage of the medication is every 4 hours, or every 4 hours is needed. Basically, 2 puffs is what a normal dosage of that medication would be. So, going on to the administration of the medication, we definitely want to be able to know how to use it correctly. So we want to, first of all, shake the medicine up. This here that I do have in my hand today is a placebo, by the way. It is not the actual albuterol medication. We first want to identify the drug that we're actually taking. We're going to look on there to see what the expiration date is, because we don't want to take medication that's out of date. It can actually hurt you more than it can help you if it's out of date. After it's shaken up, we want to actually prime the medication. That means squirting it out of there. And if you see how forceful that medication is coming out of there, you'll notice that if you put this directly in your mouth, it would actually hit the back of your throat And moisture would stick to moisture, and medication that you would not receive because it's sticking to the back of your throat. Otherwise, after we have primed the medication, if you were taking it by itself, you would want to hold this about 1 to 2 finger widths away from your mouth, with your mouth wide open, and to be able to take the medication. Otherwise, after that is done, you want to breathe out, pretty much blow out your air. Go ahead and click it. And slow, deep breath at the same time. After you get your breath all the way in there, as deep as you can get it, you want to maybe hold it for just a moment. The reason why we take a slow and deep breath is twofold. The slow portion of it, we want to make sure that it doesn't go too fast, because the faster it goes, the more vortexes or swirliness that gets into it, and it's going to actually coat the trachea on the way down and not get to the receptor sites that are pretty far down in the lungs. That being said as well, that's also why we take a deep breath with that, is because those receptor sites where the medicine works, they're pretty far down in there. So we want to make sure that we get it in there nice and deep. And that basically covers the medication and also the administration portion of it. So what happens if we can't take the medication, or we have, because of coordination issues? Well, we have something for that as well, and it's called a spacer. What it does is it just puts a space like between you and the medication, just like it says in its name. You notice it has a little hole in the back here, nice rubbery little slot. We just put the medication into the back of it. Nice little snug fit. Some of the other characteristics of the spacer is also that not only does it put the space between you and the medication, it also has one-way valves in here. So you cannot blow this medication away from you when you should be breathing it in. It redirects that airflow. This device you would actually put directly into your mouth, as opposed to the actual MDI by itself. So otherwise the procedure is exactly the same, but we would just have this spacer to contain the medication and put the space between there and redirect the flow if your coordination is not that good. Otherwise, for cleaning of this equipment, we would actually want to just take some warm water and get any large amount of debris that's off of it first, and maybe just rinse it with the warm water and then just let it air dry. Now, if you're worried about any kind of germs or bugs being on there, if you will, then we're actually going to soak this in 1 part white vinegar and then 1 or 2 parts of water. So that's soaked for about an hour, and then you rinse it off with clean water and let it air dry. This actually concludes my speech for how to take an albuterol MDI. I hope that we have shown that because of the receptor location being pretty far down in the lungs, and that the moisture sticking to moisture in the back of the throat, and that the flow rate itself can actually change how much medication is delivered to the lower airways where the medication will work, that we have demonstrated the appropriate way that we should be able to take an MDI. Otherwise, my message to you would be is that it sounds pretty complicated at first. It's not that simple. There's some things to think about, but you can do it. And what I would also want to promote is that you would take this information and spread it amongst anybody that you know that takes albuterol MDIs or MDIs in general. It's great information to be able to spread about. And thank you for listening, and go on and do great things. Thank you.